Dr. Batista received her Doctor of Medicine from the St. James School of Medicine in the Netherlands Antilles. She then completed her pediatric residency at John H. Stroger Jr. Hospital of Cook County in Chicago, Illinois. Dr. Batista is board certified in pediatrics by the American Board of Pediatrics, and she is fluent in both English and Spanish. She sees patients at Primary Care Associates in Kankakee.
Thank you, Katie, very much for the introduction. My name is Dr. Josefina Batista. Congratulations to all the prospective parents today, prospective siblings and grandparents. So I'm here to talk to you today about Yay, Baby on the Way. I always like to start off with decisions that you might be approached with that you were not necessarily considering. So we always like to talk about breastfeeding versus formula feeding. So with breastfeeding, the AAP does say that breast is best. So we do advocate breastfeeding as the optimal form of infant feeding. Not only does it provide benefits for the infant, but for the mother as well. So maternal benefits include maternal fulfillment, so you have that bonding with your baby. You get a release of good hormones, makes you happy. There are a lot of health benefits as well. You can recover from childbirth more quickly. It actually decreases pain. You can decrease your rates of breast cancer, ovarian cancer, type 2 diabetes, rheumatoid, cardiovascular disease. It also works as a natural form of birth control. And then in regards to infant benefits, the list is endless. I picked a few here. So it provides natural antibodies to fight infection. We actually consider this what we call the baby's first vaccine. So anything that you may have been exposed to in the past, you have created some antibodies for it. When you're breastfeeding, you're providing these natural antibodies to your baby. They're also less likely to suffer from allergies. They're less likely to develop asthma, diabetes, or become overweight. So tips for successful breastfeeding. So this is something to discuss with your OB. There is something that we call the golden hour, which is skin to skin for the first hour after birth. So the first hour after birth, baby's suck reflex is the strongest. Babies that do golden hour have the highest rates of breastfeeding success. So it's something to discuss with your OB. So if baby transitions well after birth, they might just put the baby right on your chest and have her start feeding immediately. Here in the Riverside Birthing Center, we do have a lactation consultant, so that's something that you should definitely take advantage of. They can kind of help you with the little nuances of breastfeeding, helping with the latch, keeping the baby awake while feeding, or any other little issues that you might come up along the way. Now, regarding formula feeding, in certain situations, formula feeding may be the only option for the parents. So if that's something that does come up, the FDA does monitor all formula. So there is an act of Congress that governs the contents of infant formula. So at the base, all formulas are created equal. They have to have the same protein, carbs, fats, nutrients for the baby. So choosing a formula may not necessarily be so difficult. We do recommend a cow's milk-based formula. We do say, though, however, to avoid low iron formulas. And then in regards to soy formula, it's only really indicated in special cases, so that's something to talk about with your primary care doctor. There are also special additive formulas on the market. There's not enough evidence confirming any positive effects. So at this point, there's nothing in particular that we would recommend in addition to what they already have in just a baseline infant formula. So if you do want to have changes made to your formula, you always should discuss that with your PCP if you're going to be changing the formula. Okay, so circumcision, that's another one. So they'll normally ask you that in the first day. Our OB service does it here. So it's something that it's a decision that's best made by the parents, again, in conjunction with the pediatrician. The existing scientific evidence is not sufficient to recommend a routine circumcision, meaning that every baby that's born, we don't say, okay, let's go do a circumcision. So our stance on it is that it's the parent's decision. If you do decide to do a circumcision, there are some potential medical benefits and advantages, but there's also the risks. And regarding the risks versus the benefits do outweigh the risks. So if that's your decision, then we say that there are some benefits to it. Vaccination. So they will be offering you the baby's first vaccine on the first day of life. So we do offer the hepatitis B vaccine. That's typically given within the first 12 hours. So that's another decision that you'll be approached with pretty quickly. The AAP and its 67,000 members do urge parents to vaccinate their children. They are just simply the best way to protect your children from certain bacteria and viruses. If you have any concerns, again, talk with your PCP. The CDC also has a lot of resources and open source studies for you to look at, and you can examine yourselves if you have any questions regarding vaccines or their side effects. But it's something that you will be approached with pretty soon after the birth. Okay, so some tips about daily care. So, bathing the baby. So babies actually don't need to be bathed as much as adults do. So they're not as stinky as we are. So they only need to be bathed about 2 to 3 times per week during the first year. And initially, so baby will have the cord clamped, and that cord can't get wet. So the first few weeks, it takes about a week or 2 for that cord to come off. So the first few weeks, you're gonna just towel bathe the baby. No dipping in water at that point until the stump falls off. So baby's first bath, you're gonna wanna be gentle. Typically, we'd recommend doing it in a warm room so the baby doesn't get too cold. Lay the baby anywhere that's flat and comfortable. We would say pad hard surfaces with a blanket or a fluffy towel, and then have a basin of water, a damp double rinsed washcloth, so there's no soap residue in it, and a supply of mild baby soap within your reach. Keep your baby wrapped in the towel and only expose the parts of the body that you're actively washing. Use a dampened cloth first without soap to wash her face so you don't get soap in their eyes or mouth. Then you'll dip it in the basin of soapy water before washing the remainder of her body, and finally the diaper area. Pay attention to the creases. There's lots of creases. So a lot of babies, and especially as they start getting bigger, they're gonna get more little rolls and folds. So always make sure that you're lifting and looking in between all the little folds, because there's a lot of areas to clean. All right, so a few tips for soothing your baby. So every baby is different. You will learn yours. So there's a few things that we do recommend trying out initially. You can make a baby burrito. So that's something that they'll teach you in the nursery. The nurses have a very good for you. You can also make some noise. So babies, when they're inside of mom, it's actually really noisy in there. They're hearing the whoosh of blood flowing. They're hearing your GI system making all kinds of noises. So when they transition out, they're actually more used to hearing I would say like a white noise, essentially. So some people do buy white noise machines, having a radio on, things like that, or like a ticking clock, something that sounds like a heartbeat. So you might actually find some solace in using noise as your advantage. Also keeping it still. So if your home is very loud and there's a lot of kids running around, having the baby in a room where the lights are dimmed and everything's off might help as well. Some babies like movement. So you can try walking the baby around in a body carrier or rock her. You can go outside for a walk. And then try to limit the daytime naps to no more than 3 hours a day, because if your baby's sleeping for longer than that, you're going to find that they might reverse their clock on you. So you're not going to sleep at nighttime because they're sleeping during the day. All right. If they seem to be fussy and you're not sure if they need to feed or not, and you don't think that it's time to feed, you can offer a pacifier or finger and see if that helps. A lot of people tend to think that if a baby's fussy, that you should just feed them. So what I would say is that typically about 1 ounce an hour. So if your baby feeds like 2 ounces at a time, the next feeding time should be at about 2 hours, 3 ounces, 3 hours essentially. So if you're finding that your baby's fussy after feeding 4 ounces and you're wondering what's going on, it's unlikely that they're hungry if it's only an hour later. Try other things to soothe the baby before you offer feeding. So this is really important. So I know a lot of people at this point have probably maybe had their baby showers and they're signing up for registries. Important policy regarding safe sleep. So, and I'm sure that you've probably heard of this. So there is a specific policy that we have to try to prevent SID, sudden infant death syndrome, which is back to sleep. So all babies, their first year of life, should always sleep on their back in their own crib in your room. Okay, so if you guys have been preparing nurseries and things, you won't need to have it ready for a whole year. Okay, so We recommend a firm sleep surface. I always tell people to pay attention to what the sleep area looks like in the nursery when you're with them. They have a flat mattress, a flat sheet. That's what you should try to replicate at home. Never anywhere soft. So no couches, sofas, armchairs, nothing where they can sink into it. Any soft objects like stuffed animals. I know people get little stuffed animals as gifts, so try to avoid having them put them in the crib or bassinet. No loose bedding or any objects that could increase the risk of entrapment. So again, baby will be sleeping in your room area for the first year. Baby should not sleep with you. So I know sometimes it's tempting, especially if you're breastfeeding, to put the baby on your breast and then just snooze away. It's just something to be really careful with. So make sure that when you're breastfeeding, that you're awake and you're aware, and then once the baby's done feeding, put baby back into the crib or bassinet. To help soothe the baby to go to sleep, you can definitely offer a pacifier. Pacifiers do decrease the risk of SIDS. They also decrease the risk of ear infections from 1 month to 1 year. So we do, there's a lot of benefits to pacifiers in the first year. So if baby likes it, then it's definitely a good a go ahead. And then use caution with products that claim that they reduce the risk of SIDS. There's nothing really in regards to other than the safe sleep recommendations that we have, there's nothing else that's been proven to prevent it. And then there isn't enough research about bedside or in-bed sleepers for us to have a stance on it at this point. Also, the rock and play. I don't know if you guys have been watching the news right now. So I actually had a parent today who has a rock and play. And so they were not aware that there was a product recall. There's been more than 30 infant deaths. So just be careful, because it's possible that you might have done your registry before that recall came into play. I think they put the recall in April 12th. There's a class action lawsuit that they put in yesterday for those parents. So just be careful, okay? So, see. All right, so another one, baby walkers. So this is actually a dangerous choice. So in case that's in your registry as well, take it out of the cart, okay? So the AAP has actually called for a ban on walkers, the manufacture and the sale of them. So I'm not sure why this is not a little more pronounced. I'm guessing that it's a lot of money in baby walkers. So with baby walkers, they're very dangerous. They can roll down the stairs, they can get burned, they can drown, they can be poisoned. So if you have them, throw them out. If you don't have them, don't buy them, okay? And then also be sure that there are no walkers wherever your child is being cared for. So any daycare centers that have them, make sure that they know that your baby should not be in that walker, okay? Yeah, I think that's a baby, yeah. All right, so swaddling. So this is another thing here. So swaddling, is it safe? It could be an effective technique to help calm infants and promote sleep. But normally we recommend to stop swaddling by age 2 months. So this is before the baby starts intentionally rolling. It can also increase the chance that the baby can overheat. So when you do swaddle, just pay attention to signs of overheating, like sweating, damp hair, flushed cheeks, a heat rash, or rapid breathing. Also, we recommend at this point keeping the hips loose. So keeping them too tight might cause issues with how the hips develop. So we recommend a swaddle that has the hips looser. So to swaddle, and they'll teach you this in the nursery. To swaddle, you'll spread the blanket out flat with one corner folded down. You'll lay the baby face up on the blanket with the head above the folded corner. Straighten out the left arm and wrap the left corner of the blanket over her body and tuck it between her right arm and the right side of her body. Then you'll tuck the right arm down, fold the right inside corner of the blanket over her body under her left side, fold or twist the bottom of the blanket loosely, and tuck it to one side of the baby. So you make sure that the hips can move and the blanket's not too tight. And so I tried to find a diagram of it. I couldn't find any hip-safe swaddling, so this is the only picture that I could find. But questions that you may have. So again, there's no official instruction manual for becoming a parent, but you can definitely find a lot of resources. So one of your most important resources is going to be your pediatrician. So choosing a pediatrician, the AAP does have a few recommended questions. So you can find out about their philosophy of care. What are their office hours, and do they have emergency coverage available 24/7? Which hospital do they use? Do they accept your insurance plan? And then what are the qualifications of the pediatrician? Are they an AAP member? Are they board certified? And with these with pediatricians, you can always request a prenatal visit. So the baby's first visit is considered the prenatal visit. So we do sit down with prospective parents or prospective patients and answer any questions that they might have. So I'd always welcome that you go interview your pediatricians to see that you find somebody that fits for you. You know, because everybody's different. Everyone's going to want to have a different type of personality, or they may have a different philosophy of their own care. So here are signs to let you know if it's time to present to the ER. So if your newborn is breathing fast or irregular, if you notice blueness or darkness on the lips or face, if your newborn has a fever is 100.4 or higher, 100.4 or higher, your newborn's body temperature has dropped. If you see signs of dehydration, which can include less than 3 to 4 wet diapers in a 24-hour period, if your baby's belly button or circumcision area looks infected, if your newborn's jaundice or yellowness of the skin does not decrease by the 5th day or suddenly worsens, if your baby is crying a lot or appears sluggish, or if you think that your baby is not looking or feeling well, what I like to tell all my parents is that you should trust how you feel. I think if there's something that you think is wrong, there probably is. So trust yourself. Okay, and then great resources for parents. I always recommend the AAP, the American Academy of Pediatrics parent website, the www.healthychildren.org. I've played around on there. They have so many great articles, a lot of great recommendations, and it's stuff that's evidence-based that you can trust. I know there's a lot of like mommy blogs and anecdotal evidence where like, oh, well, my kid, I did this and this worked. You know, so this is completely evidence-based and things that, you know, resource that you can trust. They also have a book from the AAP called Your Baby's First Year, another great resource I'd recommend if you're interested in purchasing a book to read. I think that this is one of the ones that I would definitely recommend to you. And then if you do have any other questions other interests, so they do have maternity, parenting, and sibling education here at the Riverside Birthing Center, and that's something that you can discuss with our friends here. All right, well, again, congratulations to everybody.
Thank you so much, Dr. Batista.